Hello, everyone. Welcome to today's webinar. We'll be getting started in just a couple of moments. We'll wait for some more folks to join. Well, okay. Welcome, everyone. In the interest of everyone's time, we'll get started right now. Happy New Year. I can still say that since it's still technically January. Also, welcome to the first AICOP event of 2024, entitled AI Risk, Reward, and Actions for Federal Agencies. My name is Ryan Dolan, and along with my co-manager, Nate Manzotti, I'm the other co-manager for the Artificial Intelligence Community of Practice, or the AICOP. I'm excited to be here representing the community of practice and the great work happening across government in artificial intelligence. Today's session will focus on the actions related to AI in government, including the prior and recent executive orders, upcoming OMB memorandum, and the various agency initiatives that will continue to be important this coming year. Travis Hoppe, Associate Director for Data Science and Analytics at the Centers for Disease Control, will be covering some of these actions and the steps HHS, or Health and Human Services, and the CDC have initiated to ensure safe, responsible, and innovative AI with a particular focus on generative AI. But before we begin, I want to take care of some housekeeping items. This AICOP event is open only to federal employees, including contractors who have been granted federal emails. Closed captions are provided for today's session. Today's session is scheduled to last 1 hour from 12 to 1 p.m. Eastern, and it is currently being recorded. Comments can be submitted via the chat function at the bottom of your screen at any time. We ask that you submit your questions, however, throughout the session using the Q&A function right next to that, so we may answer accordingly. Questions for Travis submitted in the chat may not be answered, but we'll try to answer as many as we can. There will be a survey poll at the end of the meeting, so please stay on and provide your feedback for those sessions so our team can help, so we can use that feedback to help continually improve these trainings as we have throughout the year. As for the Q&A, to ask a question, please enter your question into the Q&A box and then click send. Please be respectful and professional with your questions, and please state them in the form of a question. Reference the GSA Code of Conduct that will be sent in the chat right now. If the host or panelist replies via the Q&A, you will see a reply in the Q&A window. The host can also answer your question live out loud. You will see a notification in the Q&A window if the host or panelist plans to do this. Click the thumbs up icon to like a question. Tip: the question beside the icon is the total number of likes the question has received so far. Click the red thumbs icon to unlike a comment. As a reminder, chat is enabled for the meeting to communicate openly with other participants in the meeting, but please do not use this to ask questions. We will not be answering questions that are submitted in the chat. So a little bit about the AI community practice. What we do is we aim to unite federal employees who are active in or interested in artificial intelligence policy, technology, standards, and programs to accelerate the thoughtful adoption of AI across the federal government. At the AICOP, we bring together federal employees to facilitate the sharing of best practices, use cases, and lessons learned to advance and share tools, playbooks, and success stories with a community of interested professionals. There's a link in the chat that you can use to connect with the AICOP listserv if you have not already done so. Again, thank you for taking the time to be here with us today. And with that, I'd like to turn it over to our presenter today, Travis Hoppe.
Thank you so much, everybody. Let me share my slides and let's get started. And Reiner, Izzy, can I double check that you guys can see the slides and everything looks good?
Looks good.
All right, thanks, Izzy. Welcome, everybody. Super excited to be here. I have prepared a ridiculous amount of slides, so strap in. We are covering basically two different talks, AI risk, reward, and actions for federal agencies. And to kind of start things off and really highlight how much potential we have, all the actions that are going on and all the risks that are associated with it. I took DALL-E 3, which is one of the generative AI models, and I asked it to make an exciting title slide for our talk. The talk is AI risk reward and actions for federal agencies. And you can see that it really did try to understand what I was trying to do. And it came really close. It's got this cool Art Deco look to it. It didn't really understand how words work. And I think this is like a really unironic representation by DALL-E, how it thinks things are supposed to go. And it highlights all the cool stuff that you can do, but it also highlights all of the risks that may be associated with, using generative AI or AI in general. And so we're gonna step into these, but that was kind of my opening salvo into moving into the risks and rewards. So first slide. A little bit about myself. I think I've met a lot of you that are on the panel. Or on the meeting chat. I was looking through. There's this growing community out here, and we're doing a lot of really interesting stuff. I myself have published a couple papers around using AI to investigate bias within the NIH grant awards at CDC and NCHS. We have published a model about detecting non-response bias. I published the pile along with some others on Discord before I joined CDC, which is like a precursor to ChatGPT. It's the rival models that fed GPT-Neo and GPT-J. I'm the representative for the NSTC subcommittee. I'm on a bajillion community of practices. I'm on FCSM. All this is to say, I've been working on AI for a long time. And recently, over the last year or so, I've had the pleasure of working with a lot of really great CDC colleagues to bring AI, and particularly generative AI, to the forefront. And this team that I'm working with here, and I don't have time to name everybody, it feels like the Academy Awards a little bit. I'm so proud of the work that we've done, and I'm so proud of how far we are. So I want to call out everybody on the CDC team. We've done some really cool stuff, and I'm just going to highlight a few of those in the first half of my talk. So here's the agenda. We were going to go over the risks and rewards for generative AI, with particular call outs to some of the stuff in this white paper that we wrote back in June. And then I want to go into the second piece, which is a little bit of a side project for me. It is an analysis of the federal AI inventory and how it ties into a lot of the other work that's happening here. Some of the fun data science pieces, because I know we like to talk about data science and geek out a little bit. And then a call to action. So it will be a little bit better when we do it again in 2024. So jumping right in, it's really important, I think, to have definitions. You see one of my favorite paintings here is a treachery of images, which says in French, this is not a pipe. And it's not a pipe because it's an image of a pipe. Well, AI or machine learning or generative AI, these are not AI because they're all representations of AI. These are the NIST definitions, the White House definitions of AI. And I'm putting them here for you to look at. I want to say that it doesn't matter. What we should be considering when we think about AI, and whether this is AI or machine learning, whether this is machine learning or statistics, is that we should be thinking about the risks that these technologies can bring. And it's important to be like, oh, what's different about generative AI with respect to AI? But in a lot of cases, the ethical concerns and the bias that we have to worry about are the same across these models. So getting into an argument about which one is which and where we draw the line is missing the point, I think, especially for us who are thinking about implementing AI systems within our federal agencies. So there's a lot on this slide. I want to put this out there because it sets the framework of what's been happening for the last couple of years within both the federal government and within the agencies. So there's some EOs that came out. In particular, I want to call out this one on the bottom here, EO 13960, the Trustworthy AI Act. It really did talk a lot and set in motion to a lot of things that kickstarted the ultimate EO that just came out. It kickstarted a lot of the trustworthy pieces. It led to a White House Bill of Rights. There were some other ones from agencies. NIST put out the risk management framework. And if you're ever like, I don't know how I should start thinking about risk and AI and everything, I wish somebody laid out all the different procedures. It's in this framework. It's very verbose, but they also have a playbook, which is a little bit lighter to read. These are the things, if you're going to start in your agency and start thinking about it, this is where I would go. This is kind of what's happened in the last, I would say, year or so. There's all these really interesting pieces by both the White House, but also the latest EO that I think we've talked about quite a bit here. There's this draft memorandum that's coming out that's really going to affect all of us there. And then there's this little thing here, the explore the uses of government AI. This is a screenshot of the AI inventory. It's the whole second half of the talk coming up here. This is kind of the thing that I was alluding to earlier. I really love that CDC has taken the initiative and we're able to talk about this a little bit, our artificial intelligence roadmap. So this was released a couple months ago. We've been talking about it. We have an AI strategy. This is a publicly released strategy that we're about to, we're clearing through comms. We're talking about how this is going to look. It is how we're presenting ourselves to the public and how we're guiding ourselves internally. We've also, just like GSA, just like HHS, we have our own community of practice, which I think has about 800 people in it. We are working on releasing generative AI guidance, so specifically guidance just around generative AI. I believe the last count is about 26 pages. It's really, really good. It covers all of the questions you might want to ask. And even if it's not fully prescriptive, it tells you where you should start looking for it. We have a comms team devoted to it. We have this AMC team, this AI/ML consultation group that is filling in all the different governance pieces as we think about it, because there's a lot of questions that you don't know to ask until they come up. And then we have investments in infrastructure. And again, this is not a talk about this, but this is things like setting up ChatGPT for the rest of CDC, what that would actually mean from an infrastructure standpoint, setting up things like Domino for machine learning. So these are things that we are making investments in through pilots and other sorts of integrated technologies. And it's a lot of stuff. And we've come this far in a year. Again, kudos to all my CDC colleagues. Before I get into the federal AI inventory, I want to pop through this white paper that we wrote internally that talked about the utility and risks to CDC, so it's from a public health perspective, of conversational intelligence technologies like ChatGPT. And so there's a lot of text on here, but what I really want to highlight here is this is back in like February to March, we kind of wrote this. We were thinking, what could generative AI give to us? We saw that it could be really useful for drafting scopes of work. We could see that it could be useful for programming, for translating one language to another, for adding documentation to languages, for summarizing written materials, translating websites, translating tweets, creating tweets, these sort of generative technologies. We're like, there's a lot of potential here. And remember, we wrote this in early days when people really didn't know what was going on. But we also took a lot of time to enumerate what we saw as the potential risks of generative AI to CDC. Back then, we kind of highlighted things about hallucinations and fabrications, which I think to this community seems like old hat. Like we've been talking about this for a long time, but it was nice to lay this out really early on. And again, it shaped this generative AI guidance that we did. It shaped where we have moved as an agency to kind of go through this exercise and look at what we do from our mission, which is public health focused, and say, where do things like hallucination fabrications or the biases that these large language models might have from their large training sets, where might they creep in our normal everyday use? And we also kind of considered what it might mean to have malicious use by external actors for CDC, even if we never use generative AI. And so these are things for some agencies, things like deep fakes, which are a big concern, or in other pieces of disinformation. There's also the concern that things where we have RFIs or public comments, that they could be overwhelmed with generative AI. I've worked when I was at the NIH on parsing responses, public responses to government requests for information. And it's really easy to see when they're coming from forms, and you can group them together because they have templates and people follow templates. With generative AI, that's kind of out the door. And there's a lot of really interesting things I think we as the federal government need to reconsider with the existence of tools like ChatGPT that are becoming more and more powerful. And wherever we set the bar, I think it's going to be shifting and it's going to be moving. So we need to be thinking ahead. So that was my brief intro into what we're thinking about for generative AI within both CDC and, kind of moving ahead, and the whole landscape of the activities being put on by the White House and being put on by OMB, and maybe some upcoming legislation. I'm going to spend the rest of our time here, my 20, 30 minutes with you, to talk about a side project I did. This is all centered around the federal AI inventory, which I think some of you on the call responded to when the data call went out. There's a link to the GitHub here. If you manage to type that down in this brief amount of time, great. I think Izzy, after this talk, is going to maybe drop it in the chat for you to go into. A lot of this is being pulled from the README of this GitHub. But where did it start from? And so remember, I did this kind of landscape review of all the EOs that have come out, all of the actions by this administration and the previous one. In this executive order 13960 that was kind of released in December 2020, it called out that agencies must create a use case of AI inventory. So, I'm highlighting some of the main points on here, but they ask that they create them in a publicly available format. They ask that they do it every year, so it's every annually thereafter, and agencies will make these inventories available to the public. So this was an EO that came out. This is something that we have to follow through the executive order, and let's step through and look, kind of see where this goes. But also, this isn't the first kind of call to action. So that EO specifically said that we should be creating inventories. It kind of delineated the steps we should take. But this is a long standing series of things to make more information that the government does that are based around policy, give more evidence for that. And so for those of you who aren't familiar with this thing called the Evidence Act, this is something that Congress put out in 2018. It's the Foundations for Evidence-Based Policymaking Act of 2018. We like to call it just the Evidence Act. It asks for agencies to develop evidence for support for policymaking. And I see, and this is Travis's take here, I see the federal AI inventory as being a key piece of evidence to create for policymaking, describing everything that we're doing with our activities as laid out by the EO, putting descriptions, letting the public see that the work that we're doing and opening ourselves to the questions that it comes from it, I think are really, really important. So while the Evidence Act doesn't call out anything to do with AI in particular, I see the federal AI inventory as supporting things towards the Evidence Act. So let's look at it. Data was collected in 2021 and 2023. There's a gap that in between there, and there's really not data that was collected consistently between the two of them. You can find data for 2021, but it's sparse and not generally available. Some agencies have kept it up there. Some agencies have put it down. Data is provided in a variety of formats. I will step through and show you what that means with my sad face emoji here. This includes web posting, CSVs, Excel spreadsheets, PDFs. Agencies weren't given very hard lines for the columns they need to put. So there were inconsistent columns. It wasn't harmonized. They were duplicated and missing entries. Lots of problems, I think, with the data entry piece. And there was no single consolidated data set to work from. And OMB mentioned that they were working to create a single consolidated data set. And if you look over here, this is what the AI use case looks like. When I took a screenshot back in September 2023, and then I'm going to show you what it looks like now. I want to call out when I say the word agencies here, I'm referring to agencies as spoken by the executive order, which means CFO Act agencies. So all of us here, when we say agencies, we're like, oh, CDC is an agency, NIH is an agency. They're not. When we're talking about agencies, we're talking about the Department of Health and Human Services, the Department of Commerce, Department of Interior. These are called CFO Act agencies. So a lot of the things that we have to do, these things that you see here, this list, those are the agencies that we're talking about. It's just a little misnomer, but it confused me quite a bit. And this is what it looks like now. If you take a screenshot as of today, it's a little bit improved in the customer experience. It's got like nice little formatting here, but there's a download the full list of AI use cases current of September 2023. So this is, it's nice that there exists this consolidated set of AI use cases that are pulled together from all the different departments. You can do things with it. And that's what I wanted to do with this project, was do some analysis on this federal AI use case. So what does it look like to the public? We've released these, we had to, it's in the EO. There is a lot of news and press that came out. This is a FedScoop article of many. It said the government is struggling to keep track of its AI, and that's a problem. As the Biden administration teases a new executive order, this came out before the new EO, federal agencies are still catching up with the 2020 AI rules. To be fair, December 2020 AI rules issued by the Trump administration. But this is a public-facing thing. We are releasing AI inventories. They're not complete. There is, in fact, an analysis by Stanford, the I think it's the Human Centered AI Research Institute, which is what the HAI stands for, that looked at all the, the top level departments and agencies and the sub agencies or bureaus, if you're in commerce. And they said, how many of them had inventories and how many of them were in there? And there's a lot of missing data that should have been in there per the EO that wasn't. And this doesn't look great. It doesn't inspire confidence, I think, within the public when we're asked to do these things and they don't show up. And there's even, I think, a couple, but this is the one that really caught my attention, House oversight committees on the inventory itself, specifically looking at the inventory, looking at things saying, hey, agency, you've talked about this AI use case in public. You've published it. It exists here. Why is it not in the inventory? And I think that speaks to us as agencies doing better with this. I think there's value in doing so, but there's value in putting it in a format that can be readily read and analyzed. So let's talk about what it looks like underneath. So for those of you who haven't heard of max.gov, it is basically a worse version of SharePoint. It's a place where all of the federal government for some time agreed that we can store confidential documents. So if you've ever needed to work inter-department work where you're working on some shared document, you're in some like metadata working group, for example, and you're trying to not email something sensitive across, you can use max.gov to drop the information. But there's also so-called public places on max.gov where if you have a .gov account and you request access, you can view them. And as of today, you can actually look at the submitted 2023 agency use cases. And these include both the ones that were marked as public that they wanted to share, and the ones agencies decided that they didn't want to share with everybody else. So the difference here is about 300, and the EO does specifically call out use cases, especially those related to defense and intelligence, that say they don't have to be made public, but they do need to be reported to OMB. So this exists, this non-public inventory, and it's nice and consolidated. Somebody put that together, and it's really nice that it all lives there. I want to talk about, before I talk about the public one, I want to talk about what we did. And so when I say we, I do work for CDC, but I also work for a center within CDC. This is the National Center for Health Statistics. We are the statistical agency that lives within HHS. Census exists, BLS exists. Those are other statistical agencies. We are the health-related one, but we've done some AI-related projects. We did this thing that I mentioned before, the non-response detector, which is a live model and exists on Hugging Face. We've done coding for cause of death information like ICD-10s. We have some work on detecting stimulant opioid misuse and use within electronic health records. We worked with Whisper that has translated speech to text. We've also worked on PII detection models. In fact, when I spoke at the GSA Community of Practice event, talking about the natural language subgroup, this is what we talked about, is how do we detect PII, what sort of services exist. It's a fun talk. We could always talk about that later. And we did our Tiger Team report, this utility and risks of conversational AI. These are all things that exist within the public inventory. So if you are hearing this and you're like, wow, I did some AI work last year or the year before, is it reflected in the inventory? Can I find it? What's in there? I think the rest of this 15 minutes is for you. But before I get into all the data wrangling piece, I built an app that is related to this. This lives on GitHub, and specifically it's a Streamlit app that's hosted here. I don't trust live demos, so this is all pre-recorded. We could see it later, but it is effectively like a cluster map, which gives topic labels that can be live and adjusted. You can highlight these different, each one of these dots here represents one of the 700 AI projects that are in the public AI inventory. You can highlight things like Health and Human Services, then you can highlight things like the Department of Energy, and you see that the red dots in the two different places, they're lighting up in different spots. You would expect that, Commerce and Interior and HHS are all going to light up different sections of the map if dots that are similar have semantic similarity between them. You can also do some word searches off this. I'm not putting the link in the chat right away because I'm fairly certain that the 354 of you, if you all went to the site, you would crash it at some point. So I am leaving it open for a live demo at the moment, but I'm happy to share this with you because I think there's a lot of value, not just in this particular analysis that we did and some of the really cool things that we learned, but in building this sort of app yourself. There's some lessons learned I did here when I did this project that really helped this type of analysis. I think I've done this probably 2 or 3 dozen times in my career where somebody comes up to me and says, I have a pile of data, help me make sense of this data. And they're grants, they're publications, they're NOFOs, they're RFI responses, they're federal AI inventory items. And so this helps us like put it together. And I thought it would be nice to kind of go through the nitty-gritty of what that actually looks like. And so this is a dramatic reenactment of me over the last couple of months working in the data science mines. This image was also created by Dolly. I think it's kind of fun to throw these fun images in, but this is a workflow that I did. It's scraping all the documents, which is easier said than done, parsing those really sad PDFs into CSVs, harmonizing the fields, building consolidated tables. This is the boring metadata work that really makes a huge difference. Harmonizing the text, which is something new that I think is really fun, computing the themes, mapping those projects to themes, repeating the analysis with GSA's themes because they had done some analysis as well, building emojis, again, side note for user experience, but really fun, computing embeddings, which we'll talk about really quickly, clustering them, building keywords, and then visualizing the data. So all this is in the GitHub that you can look at. But I want to step through these pieces because if somebody did this to me 10 years ago, it would have been incredibly useful. If you know what you're doing and you're like, yeah, that's fine, I know how to do this, maybe there'll be a piece or two, a particular technology that you're like, oh, this should be useful, and let me incorporate that into my workflow. So I'm trying to keep it at all levels for everybody here. So the data scraping, I made a picture of what it looks like here. We have all these different links to the websites that exist. Some of them are links to PDFs, some of them are links to URLs. They changed. So I did this over the course of a month. And as I was doing it, agencies were getting pressure from OMB to update their use case inventories. And oh my gosh, I would do all the work. And I'm like, is this the same PDF? Is this the same website? They would silently change it, which note to whoever's the data stewards, don't do that. This is Sad Evidence Act noises here. Please don't change things without version controls. Please let's do a better job about this. But if people are doing this to you, you can use a hash trick, which I found to be super, super useful. Have a script with all your URLs, download them, compute the MD5 sum, the hash of that, and then just run a little like email alert and be like, hey, the hash change at hhs.gov, you need to fix it. It sucks I have to redo the analysis, but it gives me a little bit of a sanity check that things aren't shifting beneath me. So I went through and I acquired all the raw data sets. Unfortunately, there were 2 really big departments that left them as PDFs, and I will name and shame them. This is both Commerce and HHS. We can do better with and creating machine readable data. In some places, you can parse this. So in Department of Commerce, I'm going to show you how to parse this table. And some for HHS, when this was released, you can't parse it just because of the way the PDF was created. When I did this, I had to copy and paste all a couple hundred of them by hand just to get them in there. And I call this out for 2 reasons. One, HHS has fixed it and they've put a beautiful CSV. So props to Greg Singleton and everybody else that's on that. But 2, like it's really, really important to know that you can't automate everything. You have to do the ugly data science work. And I get to mentor a lot of great data scientists and like, cool, we could do this thing. You have to remember you sometimes have to get in the trenches and just copy and paste, fields for a couple hours just to get that data set that you need. But let's look at the one on the left here, this one from Commerce. How can we parse that and turn this into a CSV? Camelot to the rescue. If you've never heard of it, it's a fantastic little tool to scrape data from PDF tables. It uses the lines and the spacing and heuristics to kind of pull out, oh, there should be a column here. Oh, these are headers. I can maybe ignore these things. And it works 60% of the time. And that 60% of the time means you don't have to manually parse it. Where it failed for the HHS case was that there wasn't enough space in between these things and there wasn't a line. So you know how we say things like, hey, we should improve the user experience and have more spacing and make things more machine readable or more human readable? in turn, for heuristics, that actually helps for machines too when we're trying to parse these things. So, having that line there could have helped me parse it. Again, HHS has fixed it and it's great. And there's a beautiful CSV in here. But if you ever come to the spot where you're like, I have a table and I need to fix it, I wish I could. Camelot works really, really well for that. And so then we have to do the boring work of harmonizing all the fields. Agencies just added new fields. Agencies changed the names of the fields. And so I had to make some decisions on some omitted fields, looking for a common set of responses to this federal AI inventory. These are the ones that I had come up with: this department code, agency, office, title, summary, development stage, not everybody put them, the techniques, again, source code, not everybody put them. And I was like, man, it would be really nice if we had a universal identifier for this. OMB didn't have one. So I created one. It was the agency name. So like HHS or Commerce, whatever it would be, a 4-digit ID, prefix was 0, and a 4-digit year that's in there. And I just put this in a CSV. And I said, OMB, that would be great if we could clean this up, and posted it. And they said, cool, we hear you. And so they just posted that CSV. And that's what lives there right now on AI.gov, is this CSV that was created kind of in this side project. So if you need the real data set, it's both on the GitHub and it's on here. But I really do want to call out, like, harmonizing the data is a little tricky. It's a thing that we have to do. And then having an ID that we can refer to, like Project 37 back in 2022, that means something now. And so attaching identifiers, I think, in the future is super important. This is something that's super cool, and we're about to shift gears and use generative AI to do some of our analysis, is not just harmonizing the fields, but harmonizing text, right? So some people wrote 3-paragraph descriptions, some people wrote a couple lines, and that is not consistent when you're doing kind of downstream analysis. It'd be nice if there is a consolidated summary of every project. So people who wrote 3 paragraphs, I can have the same piece of text. So what I did was I used ChatGPT. At the time, 4 wasn't out, or it was too expensive. I didn't want to pay for it. So I used GPT 3.5, which worked just well enough to take everybody's description. And using this prompt below for all 700 of them, I said, take this, summarize the text below into 2 or 3 sentences using declarative language. And this is what it did. This is the IRS one that you see up here. And this is what ChatGPT decided it should generate as a short summary. These are really good. This is an incredibly good use case for it because it's summative and it's generative at the same time. It was designed for doing things just like this. In fact, it was so useful that I started building a prompt library of all of these things, which people are starting to call programming 3.0. I collected a lot of these prompts, they're in there, and I found these to be useful. Something like cleaning the typos, cleaning the boilerplate, finding major modalities or major themes. And there's a lot of like nuances that you have to do. What's funny is that when I did this back in September, I showed this to somebody recently. They're like, have you heard of LangChain? Did you know this exists? Yeah, this is what LangChain does, is kind of put these things together. But it's useful to kind of think about where this works and where it doesn't. It's crazy useful how you can take something like a public comment that has an address and a salutation and use ChatGPT to strip that so you can just get the content for your downstream analysis. Amazing. It works really well for that. And so that's what I did. I took all of our consolidated list, cleaned up, summarized pieces, and I asked ChatGPT to summarize each one of them into 5 key themes. I asked it, give it a markdown list so I could take those generative text, turn it into a Python object. Don't use any special punctuation, like make it clean. It sometimes gave really complicated themes. So then re-asked it for each one of those themes to simplify each one of the themes, get rid of specific details. Then I had this like giant list of themes because it's 5 times 700. And I said, and I chunked it in as big of a certain list I can give to ChatGPT and said, here's a big list of themes, summarize those themes. So I would go from like, 500 themes down to 30, and then 500 themes down to 30, 500 themes down to 30. Keep doing that. Now I have 100 themes, and I went from those 100 themes down to a smaller list and smaller list and smaller list until I got kind of a reduced down set of lists. So this is like a very different approach than clustering and looking to see what the clusters give you. This is asking generative AI if it could give you topics, and it did. And I think these topics are really good. I think they capture it. These are soft topics, so a theme could apply to more than one of them, which is why the numbers add up to more than our 700. But then you can score them. You can say, oh, here's a bunch of themes. Here's environmental, healthcare, cyber intelligence. Here's a response. Use a JSON object and tell me which one of them fall under cyber intelligence, which ones fall under fraud. and it gives you results, and they're pretty good. And if you want to improve the accuracy of something, you can then go through on all your true positives and say, hey, does this theme really talk about geospatial issues? Please describe it. And if it says no, it doesn't, then it was a false positive. And so you can actually clean it up a little bit. And I found increased in accuracy if I wanted to do that. Also, you can do this for the GSA categories. We saw this, but given a GSA category, you can do super cool things like say, now I've got 13 in the finance category that GSA came up with. Describe to me what's in this case, what sort of projects are in there. And I can see things like labeling cost data, estimating compliance baselines. Super cool. Now I know all the finance projects that are happening. Like if you want to learn something about your data set, this now exists for all of these categories. Do I think it's a little bit permissive? Does it match up one-to-one with GSAs? No, but that's not the point. If a human did the same thing, they're going to come up with slightly different categories. It is a high-level analysis of the data. It would be interesting kind of downstream to see how much they matched up with GSAs, but really it's really helpful to see what's in your data set. So things like what is actually mission enabling? That was a thing that seemed kind of new to me as a theme. GSA said it was important. I was like, oh, I see, improving document workflows, enhancing FOIA responses, detecting suspicious activity. This makes sense to me for mission enabling technologies. Super, super cool that this exists. You could also add emojis. This increases, I think, the user experience. This is the fun part of the talk. You can say, here's my theme, here's some sample responses. Come up with an emoji for doing this. I found after presenting this a couple of times, it helps ground the users, and you can ask for kind of the social context behind it. And it makes you think about these categories a little bit more. Like if I'm putting this little seedling for education and workforce, what is that kind of telling me to the users? What sort of context am I giving? I love it because it makes me think about things before I'm presenting them. And you don't have to go with these things, but this is another use case of GPT where it's helpful to kind of expand upon the knowledge that the authors already have. Okay, cool. So now we have all these things. Now we're going to go towards a visualization. Now we're going to try to build something up because it's fun that you have summary reports, but people want to see a picture. People want to be able to explore nearby topics. And so the trick to all this is these things called embeddings. And I feel like this audience is fairly well versed in what an embedding is. But for those of you who have never heard it, it takes these things that are like really chunky and discrete, like words. There's no way to smoothly blend between cat and dog, even though in some ways they're semantically similar. They're both pets, they're both animals, they're both mammals, but there's no way to like very gradually move from one to another in the space of words. But you can map words to vectors, and in this vector space, then you can interpolate between them. That's an embedding. There's a lot more to say about it, but it allows this idea of a quantifiable closeness between one word or the other. They can be scaled up from just words to sentences to whole passages. In our case, we're building embeddings on each one of these summarized responses for the federal AI inventory. Super important that we worked with these summarized responses here because the big ones would confuse us with all these extra links that the authors thought were important. If we just keep the summaries, then the embeddings are focused on the important part about this. So what this does is it maps any series of words into a vector, in this case of about 1,024 numbers, then we can compare them. And at the time I use OpenAI's embeddings, but really any sentence embedding that I use could work really well. And so how do we build these kind of cool labels? This is like an ongoing thing for anybody who's done NLP. It's like, cool, I've clustered my data. Now I got little clusters. I want to show the user what exists on top of that. Swear to God, it's a thing that all of us do all the time. And I feel like this is magic and it works really well. So I wanted to share this with you. So we all know how to take high dimensional data, move it down to 2D. These are things like UMAP or TSNE, map it down to 2 dimensions. Cool, we got a bunch of dots. I'm going to go through a series of slides and you're going to see what I'm talking about in these bullets next. But the trick is this. You use k-means clustering in 2 dimensions because you want the labels to match up. Find the centroids. Maybe we're doing k-means equals 15. So I'm finding 15 centroids. Are they perfect? No, but it doesn't matter. We're just putting labels on it. And then we group those. And so these 15 might have 37 documents in this cluster, 20 documents in this cluster. That's a cluster. Subsample them as many as I can fit into this and use KeyBERT, which is a fantastic little, it's not generative AI, but it uses BERT to find semantically similar subphrases in those documents that are most similar to the main documents out there. So it does use like embeddings, but it finds like the 1 grams or the 2 grams that don't show up the most, but show up the most semantically. And it's like the right way to do things. But you need to get the right set of documents to find that. And then you do it for every k-means, you pre-compute it, and then you map administrative data onto it. And so that looks like this. 1,024 dimensions, mapped down to 2 dimensions. I used UMap. Cool. It's a bunch of dots. I can tell you this dot here in the upper left. These are chatbots. The ones down here are all the VA pieces. Up here is like, I think the energy ones, the science ones related to file LinkedIn and all sorts of interesting stuff. And then find some clusters. And for each one of the clusters, I want to find the 2 grams out of that that are most semantically similar to the cluster itself. And oh my gosh, it works so well. Are they perfect? No. Chatbot assistant, very good. This I can tell you down here that says vaccine. These are all VA stuff. And so vaccines are a big piece of it. Not fully informative, but also really useful. Designing gas, maybe not the most useful one, but I get a sense of what's in here. And again, I can always dive into it, or I could have a bigger K. You know, there's more text on here for the user, but you can really work with this. This is with, I think, K equals 50. And now you can see things like predicting health, Google DeepMind, preventing suicide, clinical data here at the bottom. You see things like the hardcore science pieces, the STEM pieces here on the right, all the Department of Interior stuff. Super, super useful. And one thing about finding clusters is it gives you text spots to draw your labels that don't really overlap as much as if you just tried to like do some weird like soft repulsion thing to get your clusters to find good spots. Super cool. I borrowed this technique from a couple other people, modified it for this project. And then you can put administrative data on top of this and get some really cool stuff. Like here's the Department of Interior. And so when we put this all together, this gives you this app that I built for you, for myself. And I've been using this quite a bit to kind of put things together. As you see, if you highlight over any one of the different projects, you can see the text associated with it. You can see the different labels, give you more information, give you less information. Absolutely, if you're building Streamlit, please pre-compute them. You don't need to do this live, and you can because you've got the compute time off the clock. And then you can use this to kind of highlight a particular thing like here's HHS. And in my last couple minutes, I want to talk about the costs because people are like, wow, this is so expensive. And it's like, yeah, I did pay for it. It was $1.50 to make 7,000 calls, or I'm sorry, to make about 3,000 calls with a little less than 250,000 tokens. And the price has gone down twice since then. And here's my soapbox right before I end for you guys. We can do better. And I'm not just going to say we can do better. I think there's a correct way to do this. GSA has this cool little tool called Touchpoints. And what typically happens for data calls is that for any data call, not just the AI inventory, is that Excel spreadsheets are sent from the top, maybe OMB, they go to department heads, they go down to agencies or bureaus, and then they get distributed maybe, and we have like 4 days to put something together, and we do our best. But I think we can do better. We need like a Google form, and Touchpoints is a Google form or a Microsoft form, but it's within cloud.gov. It has a shareable link. It's FIPS moderate. It's free for us to use. We can have standardized fields. It has API access for like real-time reporting. And it still doesn't mean that, you know, people are going to submit their crazy ideas that aren't part of the agency's mission. There's still time for agency review. They're not going all the way through. They can still go back up to each agency and be like, hey, here's your use cases. How do you feel about them? Let's pick out the ones in there. I think this is something that I'm pushing CDC to do really hard. I would love HHS to do that. We've also had conversations with our chief AI officer about it. But I think all of us on here can put this together. And so if you're interested in this, please contact me and maybe we can just kind of coordinate all of this together and we could just do this and do it well, basically eat our own dog food on this. And I was told to end at 10:42, so I'm 1 minute over. So thanks. You.
Thank you, Travis. Well, that was awesome. We have a lot of really thoughtful questions in the chat. So I am going to start off with one around, well, I'll kind of combine 2 questions. So we all know that IT constraints can be sort of the fall for a lot of data projects and AI projects. So we need to consider them up front. And so we have a question about any suggestions about how to work with IT to get access to needed technology to complete this type of work. I think it would be great to hear from your experience on the AI cases that you've worked on. How did you work with IT? And then there's another question, which is which I'd like to to give you, which is, did you collaborate with CDC, HHS cyber, IT security staff on internal and external risks, not just CDC business?
Absolutely. And I think if the answer to that question was no, I think all of us would be in trouble here. At the very beginning, there are questions that absolutely need to be answered in terms of IT security and IT boundaries. And I think this was a bit of a challenge for us because like our CISO has been fantastic in delineating security boundaries and saying, this is okay, this is acceptable. When we're talking about bringing ChatGPT to CDC, it's coming through Azure and it's coming through the services in the ATO that are already provided. But these are the determinations that they have to make, and they give us the guidance for this. They were very clear that they don't want to make the guidances based off of ethics or should you do this. They were just saying, could you do this from an IT and security perspective? So if your agency is thinking about standing them, we involve not just our IT and security people, which I think is essential, but also our Office of Science and our associate directors of science. We involve our ethicists. We got our lawyers involved to make sure that the guidance that we're putting out, that these guidelines that we're building up, even though they're not official policy yet, they are things that are considering all of the perspectives that we might miss. On top of that, we also made sure to bring in program staff, the people that are doing the analysis and the people that would actually be using these tools to do our kind of mission related activities. All of them needed input at every single level. I can answer Crystal's question right in the chat right away. Will there be guidance on reporting for the inventory in the future? Yes, OMB is expected to put out guidance on what to do. I think they're coordinating with GSA on different levels for this. This is something that I don't have anything further to say on that. We're expecting some sort of guidance on what to do. Either way, we have to do it in some way. And so how we collect this data, I think, can be incumbent on us to coming up with a good system to do so. Ultimately, it needs to go up to OMB and they will post it, but we could collect it in a really smart way.
And going on with another guidance and policy related question, we have a question around how has the EU AI Act influenced your AI policy and guidance?
It's such a great question. There's so many players involved, right? Like I didn't write the EO. I mean, I think we've contributed, all of us have contributed in some way to the EO and the OMB memorandum, but we're very aware that there's things happening in other countries, the EU being the biggest one. I think the way to think about these different things is there's different levels of permissiveness that countries have taken. Some countries have been very adamant about banning these technologies straightforwardly. Some countries have been kind of moderate, like I'd like to protect consumer rights and maybe not have the most, be very cautious and slow in adopting these technologies within both the commercial sector and their corresponding federal sectors, and others have been more open. And I would say the EU has kind of been more on the moderate side. They haven't shut things down, but they also haven't been as permissive as other countries. And absolutely, we're reading every other country's actions and trying to see what is working for them and what would work for us in our context.
Let's see, there's a lot of questions. So let's see. So I guess, Travis, what are you or your team members using as AI tools in their daily workflow? I know that you're a Python programmer yourself, so I'm sure that there's a lot of things. You mentioned Hugging Face. If there's any other tools you want to share with this audience.
Yeah, thank you for that question. There's what I really liked, when the GSA community of practice organizers came to me and said, hey, do you want to give a talk? I want to talk about the risks and rewards, but I also want to talk about this side project of the federal AI inventory. I did that on my own. I thought it was really interesting and it ended up being useful for my work, which allowed me to kind of explore a lot of tools I wouldn't before. I made a point during this talk today to highlight the specific tool that I used and how I found it was useful. Things like Camelot, things like Hebert, Streamlit, these technologies ended up being really, really useful for the data science workflow. I want to call out, what are we using it for in our day-to-day? This is something we're figuring out, and we're trying to look and work within our generative AI guidance that we're about to release. I will say that we ran 15 different pilots across CDC, and they weren't just our data science folks. They were people in policy and legislation. They were people who were doing stuff related to, looking at self-harm and pieces of text, people in our injury center. And these sort of projects are people who heard about the potential of the technology, and we encourage them within kind of an enclave that we set up to test the technologies and to see if they work. And some of our pilot users came to me and they're like, it didn't work, it's terrible, it can't answer my questions. I'm like, no, it's absolutely a success in terms of a pilot letting us know that like this technology is not really ready for these sorts of things.
Sure. And Travis, I don't know if you'd mind pulling up one of your slides that shows the CDC AI activities that you guys have done. Someone asked if you could talk about some of the use cases that you're familiar with, describe what they do, how successful are they in production and prototype form. Another individual asked about use cases for AI to scan procurement contract repositories to help respond to either FOIA requests or congressional agency contract award files. I know this use case is a little different than what you're doing with the PII detection and FOIA, but I thought maybe you know of a use case that's somewhat similar. So over.
Yeah, thank you. And can you see the slide? I think this is what we were talking about here.
I was actually thinking the one that has, I think you have like, I think it's later on. There's a slide where you show like what you guys have like built.
Oh yeah, this one is just the stuff within the center. Yeah, so this is not even CDC. This is just the National Center for Health Statistics reported activities. Okay. This is what shows up in our inventory. Yeah, these things are super exciting. None of these are generative AI. They're all just AI or machine learning or advanced pattern matching that we felt fit the criteria for these. I think that they are really exciting projects, mostly because they're solving a need that existed. So one thing I noticed within federal agencies is that we have lots of data that isn't analyzed all the way. And so my center is full of statisticians, and I feel like there's a lot of data that could be turned into statistics for them. We have image data, we have text data, and for a lot of the work that they traditionally do, it needs to be numerical. It needs to be tabular sort of data. And so part of the challenge to communicate to our data scientists here is how do we turn this kind of rich information that we collect? So NCHS has all of the death records for the United States. It has all the birth records. So all the vitals exists. And we do these great surveys like NHANES that create these incredibly detailed nutritional surveys. Amazing. If you're in public health, you've probably heard of these things. But not all the data I feel can be utilized to its full extent because it's this weird multimodal sort of data. Maybe it's image data, maybe it's text data, maybe it's survey data where people responded, maybe it's recorded interviews that we had. And so all of these projects look to enhance the data that we already have. They're not making predictive things off that. They're turning data that we have and saying, oh, is this a non-response? Oh, help us code the cause of death. Oh, detect whether this is an opioid use or a misuse, so that it can help this downstream analysis. Oh, it's recorded text and your transcription.
I'm sorry.
Yeah. I'm sorry, go ahead.
I wanted to just, so would you say that these models that you've developed in-house, do you use them regularly? Would they be considered in production, or would they be considered in pilot phase, or how does NCHS think about their AI projects and their stages?
Yeah, that's a fantastic question. And that's something I think we're grappling with. We came up with a model release strategy to do something like this. And so what does it mean around this? For us, we would ask our staff if they're going to create a model like this SANS model, to go through the stages. When they're thinking about publishing a model, we're asking them to create really detailed model cards for these things. And if you were to Google SANS NCHS, you'll see it up on Hugging Face, and it has a really nice model card that's associated with it. And I think, going forward as a governance model, having model cards is the right way to create an artifact for people to see.
And so, so I guess in that case, so your Hugging Face model that you guys built, that would be considered an LLM. Is it BERT based? Just out of curiosity. Yeah. So that goes into sort of another question. That's why I wanted to like confirm, is someone asked, as far as cloud services for accessing and deploying LLMs, is there guidance on most secure FedRAMP models? I'm not sure if there is, but I thought I would field it to you.
Yeah, absolutely. For that SANS model, it was small enough because BERT's small. It was a SimC model. We were able to train it on basically a desktop computer. We actually fine-tuned a model to be specific. For the Whisper model, again, small enough that we can run it locally. So I think there's two questions here. Can you run it locally? Do that. Versus cloud-based models, which is the focus of the question. For cloud-based models, I think for us, we need them to be FedRAMP approved, and you need to go through, that's where you work through IT and security. ChatGPT has an ability that is FedRAMP secured already, or FedRAMP approved, that you can go through the Azure Web Services and maybe AWS. I'm not sure about that. That's how CDC is envisioning us moving forward in that.
Thank you so much. Great, sir. A lot of questions. Let's see. Someone did ask, you know, I know we're at 5 minutes to time though. How many more minutes do we have? I don't know if we know. I know that we typically close 2 minutes before. So someone asked about your—
One more question.
Okay, sure. Okay, so let's see. This is a question that's more around, I guess I'll just, yeah, I'll pick a question. So you had a plot that shows your embeddings, and this question is really just trying to understand what the X and Y coordinate of each dot represent. And they'd like to understand why the dots are placed across the canvas.
Super good question. It's everybody's first question when they see an embedding. It is, how do you take really disparate pieces of data and put them in one visual? The trick to that is to put things that are semantically close to each other together. Where they actually lie on the XY doesn't matter. What matters is who's close to each other and who's far apart from each other. So that particular map you see really just shows you the groupings of things that are similar to each other. That's the power of embeddings, is to show semantic similarity, not the exact picture. If you're like, oh, that looks like a continent, it doesn't really mean anything. What means something is what's close to each other, what clusters are touching each other. Can I infer meaning from that? And the answer to that is yes. And so I think we are at time. And I love all the questions, and I wish I could answer them all.
They were great. It was hard to pick.
Well, great. And thank you. And this brings us to the end of our Q&A for today. If you have a moment, please take a moment to respond to a quick survey for today's events. The poll should appear in the front of your screen. Thank you, Travis and Izzy. This was a great event. And we invite you to all stay connected. Please join the AI Community of Practice listserv by emailing ai-subscribe-request@listserv.gsa.gov with an empty subject line. For more information, please follow us at the link that'll be provided in the chat. Again, I'd like to give a sincere thank you to Travis for such an insightful and enriching session. Finally, I'd like to thank you for all of the attendees. There was quite a few of you today for joining us in today's session. We appreciate you for being with us, and we look forward to connecting with you next time. Thank you again.